Well, hello and welcome to the North Carolina Unique Pathways to Medical and Healthcare STEM Careers. We're having a wonderful series, 4-part to be exact, and each one will be basically talking about one particular area in STEM. And so today our focus is on medical and healthcare. And with that, I will turn it over to Teresa, who will take us in.
Great. Thank you so much, Stefania. Welcome, everybody, to our very first Career Pathways webinar. We hope that you will get to learn a little bit about the careers of our panel tonight, but also a little bit about kind of their journey to where they're currently at in their STEM career. Really, really excited to be offering this webinar series as part of the North Carolina Collaborative for Advancing Student-Led Research. The North Carolina Collaborative is made up of 4 organizations, and together we host these major science and engineering research competitions across the state of North Carolina. So if you are a teacher or a student in North Carolina and want to learn more about these competitions, we would love to hear from you. We are very proud of the success of these competitions and the work that the young student researchers do to come to us. Before we get ahead of ourselves, we did invite you here to start thinking about different pathways into careers. And so we'd like to invite you to drop some thoughts into the chat to get us rolling. And we'd love to know what questions are floating around in your head about education, boards, or career paths that you're hoping to learn about today. So if you have thoughts, questions, we invite you to drop those in the chat right now. And the sky's the limit. So feel free to drop in kind of, how did you get into this world? What do you do every day? Whatever thoughts are in your head, and we'll do our best to bring those up throughout the session. All right. So if nothing's popping up right now for you, that's fine. We do have time at the end of the panel tonight for you to be able to jump in and get some Q&A, and I will help along with that. And Stefania is actually manning the chat tonight. So if you have questions that pop up as we go along, she is going to be there to kind of respond to you or to jump in and throw that at us as we go through the webinar tonight. And with that, we're going to jump in to introduce you to the panelists. So I am going to introduce the panel by name and their official role, and then we're going to take down the slides and let you meet the real panelists and hear a little bit from them about their careers. So starting out, I'm excited to have a panelist of 4 women leaders in STEM with us tonight. And our first panelist is Dr. Frida Sanders. She is manager of EHS and biological safety at Pfizer. Oh, and all of these women are North Carolina STEM leaders. We have Dr. Carolina Vera, and she is clinical assistant professor at the UNC School of Dentistry and also holds the title of president at Build Your Smile Dental Foundation USA. Can't wait to hear a little bit more about that. Also joining us is Dr. Parisa Tashakouri, and Dr. Tashakouri is a pediatric dentist at Bluebird Pediatric Dentistry. And finally, we have Dr. Lauren McCormick, who is Senior Vice President in Communications Practice Area at RTI International. So if you will join me in welcoming our panelists with a quick cheer with your emojis, I will take the camera off, and I'm going to invite Dr. Sanders to kick us off with just a little bit about, tell us a little bit about your career. What do you do right now? And anything that's really fun or challenging about your career, and kind of what skills you're using day to day.
All right, where do I begin on that? So I think that my my career path may be a bit different than some of the other panelists. We all have really cool professions. Mine is in the area of safety, so it could be transferable to really any field. However, I stay closely tied to life sciences as much as possible because of my background, which is in the biological sciences, in particular, plant and soil science. So I'm really used to laboratories and that environment. And so what I do is that I manage a site that does clinical manufacturing, as well as another site that does research and development for rare diseases. Some of those diseases are Duchenne muscular dystrophy, Wilson's disease, Gaucher's, and these diseases can be really debilitating for those that are born with genetic defects that make them predisposed to the disease. And so when I go to work, I'm trying to make sure that the environment is safe for everyone that's working there, whether it's an office worker or someone that's actually working on the actual drug product, or the facilities worker that's making sure that the air handlers are working and the filtration is working for the manufacturing suites. So I love that I get to interact with every single person at each site. There's no one that I do not interact with. I think I muted myself by accident, but there's no piece of equipment that I'm not looking at from a safety perspective and learning about the mechanics of it and doing a risk assessment on it. Any chemical or biological agent that comes into the site, because I am the biosafety officer. So I look at how that chemical or that biological agent may affect the human body. Also, what effects it might have on the environment if we release it, and how we can dispose of it in a sustainable way. So hopefully that answered the question, Teresa, but I love what I do because I help people go home safely to their families each day.
I love it. Thank you so much, Frida, for kicking us off. And a unique career that I don't know very much about, safety in the laboratory. So thank you.
Welcome.
All right. Thank you for getting us started. And now we're going to pass it to Dr. Vera. Carolina, tell us a little bit about your career.
Hi, hello everyone. It's a pleasure to be here with such a talented people this evening. Well, as Teresa was mentioning, I'm a clinical assistant professor, University of North Carolina, Department of Prosthodontist. I originally from Mexico City, born and raised there. So I came here to the United States 16 years ago to pursue more education. So I was already a dentist in Mexico. So I came here to do my master's degree and specialized in complex prosthetics. So if you hear the word prosthodontist and it sounds a little bit more complex, it's just as it sounds, complex prosthetics. And this is what I do. I am a professor. I'm teaching that area in the university, as well as I have my private practice as a dentist, practicing in my field of expertise. And in another hand, I'm a devoted professional doing a lot of outreach programs. And being a professor, of course, be part of the university, you're just not treating people. And you know, of course, as a dentist, I have that that specific kind heart to help others constantly, because it's what I do every day, but at the same time, I love what I do because the university is a big platform to do all these wonderful outreach programs, trying to help the underserved communities, not just here in the United States, which I do very often. So I'm the president of Build Your Smile Dental Foundation. It is a foundation that was created several years ago in Canada for other prosthodontists, just like me, other dentists interested to have to do good for others. And their international programs were very well established, especially in Uganda. And I'm basically the representative of America, which is from the United States and all Latin America. I have the privilege to, of course, be a Spanish speaker. I have the opportunity to work with very closely with the International College of Dentists, which is the most prestigious dental organization worldwide. And I do significant amount of programs. Again, here locally, I live in Durham, North Carolina, but I work in, in different local programs, but also in Uganda. I participate with the Uganda group, so we can do different things in Africa. And right now I have been, even with the pandemic, it has been a little bit difficult to do outreach programs and travel. However, we have been supporting different mission trips to Mexico with the local practitioners through the International College volunteers and Build Your Smile volunteers, to keep helping, especially different foster homes for children or orphanages in Mexico. So this is what I do mostly.
Great. Thank you so much, Carolina. You actually surprised me with like two things. I never think international when I think of dentistry.
That's right.
Which was like, it was wonderful. But also like the teaching and giving back aspect. So I really appreciate you sharing. Thank you.
Thank you.
All right. With that, we're going to hear a little bit from Dr. Tasha Corey. Teresa?
Hello. Hi, everyone. Thank you so much. So I, too, am a dentist. I went to Appalachian State University. I was always really interested in chemistry, and I thought that dentistry would be a good field to go into to kind of be hands-on, but also have a lot of that science aspect. And I went to dental school in North Carolina. And after a couple of years of practicing, I decided to go back to school to specialize in pediatric dentistry. And one thing about pediatric dentistry that is different than some of the other specialties is that we heavily rely on medications to sedate children. So we have to have a lot of pharmacological knowledge. We have to take children to the hospital and treat them that way so that they, have a positive experience, so that they don't really remember something that could be a little traumatic, and also restore them to the form and function that they should be at. And I'm from Western North Carolina, so something that I really wanted to do was move back home because there is a big need for that type of care in this area. So I moved back home to Boone, North Carolina, and that's where I opened my practice. And we do all kinds of fun things, but one thing that I really started to enjoy is doing laser dentistry, which is where we use lasers to do fillings, and a lot of times you don't have to numb the children, and it can be a really cool experience for the parents and the kids, and it can create a really almost like a science experiment in the room, and that everyone is really engaged in. So that's a little bit about me.
Wonderful. Thank you so much. And so two very different perspectives on dentistry, different careers within the same field. I love that. Thank you both for sharing. And we're going to ask a little bit about your journey, but I can't wait to ask about chemistry to dentistry. So thank you. And our fourth panelist joining us tonight is Dr. McCormick. Dr. McCormick, would you like to start by introducing us to your career?
I would be happy to do that. Good evening, everyone. I'm Lauren McCormick, and I am not a medical doctor or a dentist. I have a doctoral degree, but it is a PhD degree. So, and that is in public health. So definitely in in a health-related field. And I work at RTI International, which, as you can see, is my backdrop. And I've been there about 25 years doing different kinds of positions. And for those of you who are not familiar with RTI, we are a nonprofit research institute And the focus is on improving the human condition. And we do that through a lot of different kinds of research. So social science research and laboratory research, engineering fields, and a lot of work in international development. So currently working in about 75 different countries. We have about 6,000 staff at RTI. So my career is in research and also in management and managing people and other scientists and supporting and helping them with their journeys. And that is one of the most rewarding things because it's seeing people grow in develop in their field. And I think one of the most exciting things about research is that you're always learning, collecting data. You're looking at information, trying to understand it and communicate it to other people. So that is something I definitely enjoy. And I know a lot of other researchers do as well. But my specific field is on public health communication. And so what I do and the folks I work with, we help people make evidence-based decisions about their health, or at least we try to, by giving them information and kind of packaging that in a way that it's understandable and useful so that they can make these informed decisions. So if you think about all the health-related decisions that we make every day, things from what you eat for breakfast, what you eat all day long, not just nutrition, but physical activity, access to healthcare services, what services you get, like cancer screenings or vaccinations, and health insurance, what health insurance you buy, all different kinds of decisions we have to make about our health. So what we do is kind of put that information together and develop and implement and evaluate information campaigns, public education campaigns, and other resources that are hopefully understandable for people. And we kind of conduct some evaluations to see if they made a difference. Did they help people? Were they more knowledgeable? Were they more informed? And so that's a little bit about what I do and what a researcher does kind of every day.
Awesome.
I see a question in the chat, which I'm happy to
you got it.
answer or
Yes.
later.
Nope, you go right ahead if you saw it. So the question in the chat is about what is your research related to epidemiology and public health?
Okay, great. Excellent question. Epidemiology is one of the disciplines of public health. And so that is a really good question. Other kinds of things related to that are biostatistics, and there's all different kinds of fields in public health. And I also spend some time, like Carolina at UNC as an adjunct associate professor. And there's a department there and folks who are doing great work in epidemiology. So excellent question.
Yes, yes. And Lauren, if you don't mind, for those of us, I didn't learn really about public health as a pathway in healthcare and medicine until I was an adult. And I would shamefully say recent adult before the pandemic, but not too much before. And so do you have a 10-second, what is public health? What does that mean?
Yeah, so we're thinking about public health, there's a lot of focus on prevention as opposed to maybe with medicine, that's somewhat of the differentiation. So if you think about that, and that's one of the ways people kind of do that, make that differentiation. So there's different subfields, as I mentioned, epidemiology and biostatistics and behavioral health. So I think the UNC School of Public Health is great. So I'll put in a big plug for Gillings to consider that in your career path for those. And a lot of people do know more about public health now that with the pandemic. So it makes it a little easier to explain what is public health.
Absolutely. Thank you so much. And a quick follow-up question, and whichever of you ladies feel compelled to jump in with this one, I welcome any of you to jump on the mic. I heard many of you talking about the many hats you wear in your life, in your career, and several of them sounded kind of like businessy or organizational management-y. And when I think medicine and healthcare, that those aren't the things that pop into mind. So does anybody have a little bit to share about kind of that part of working as a leader in STEM?
Teresa, when you said organizational management?
Sure. And that can be whatever that means to you, Frida. So thinking about people management or even some of your safety protocols and policy, those pieces of careers that we all grow into and are asked to kind of support.
Yeah, I can give several examples. So if you think about like the simplest tasks that most people overlook, for instance, one of our sites had an outdated Pfizer sign, the old blue pill, right, on the outside of the building. And there was this big push, we got to replace the signage. Well, from a safety perspective, it's not that simple. So I can't tell you how many meetings that we had just to change this signage out. So we have to reach out to the contractor and get their safety plan and their proposal, right? And there's also that technical piece. Whereas, okay, you're going to bring a crane, or you're going to bring a lift. How many people are going to be on it? Do you have fall protection? What's your rescue plan? What if someone passes out while they're up there on the crane? You know, you got people on the roof. Do they have fall protection? How tall is the wall? So all of these different things that you're thinking about, but also the personnel flow, because they can only do it during work hours. So, all right, so how are we going to reroute our people? Well, we can't prop open doors. So you got to have that security piece, got to put a security person at the other door, have signage in place, multiple site communications. Who all gets the site communication? Some people aren't, you know, they're visitors to the site, or they come to the site, you know, various days. So just thinking through the logistics of all of those pieces. And then, okay, are they utilizing ladders? Have they been inspected? So I could go on and on and on. And then they may be using chemicals or types of sealants. Well, have they been approved? Do we have the safety data sheet on it? You know, if there's a landlord, you know, depending on if you own the facility or not. So just something as simple as changing the sign. And then you also have to oversee that project and make sure that they're doing what they say they're doing. Are they wearing their PPE the entire time? That's my puppy that's barking, but are they wearing their PPE the entire time? Who's going to manage the project from their, you know, contractor side, as well as on the, you know, the employer side, so on the Pfizer side. So that's just one simple example of a minor project, but you can imagine if it's something more serious, like we're actually changing out an air handler or a chiller or emergency generator or something like that, then it's a lot more complex, or a bioreactor.
Yes, I love where you were bringing us, and I could see all the other panelists shaking their heads because you're talking about like safety and paperwork and
And then you
moving
add the
people.
pandemic to it, and then, you know, so that was a whole other scenario. Are they vaccinated? Are they, you know, can they attest that they haven't been exposed and that sort of thing? And are they keeping up with the COVID protocols? Because often what we would notice is they would start out with the correct PPE on and the mask, and then you go to observe the work a couple hours later and no one's wearing it. So, you know, just what do you do in those circumstances?
So it sounded
Thank
like
you.
it's a lot more project management mixed in with communication skill sets, things that you don't really necessarily go to medical or any other type of disciplinary school to get these type of skill sets. Teresa, you mind asking, how do you formulate these skill sets? Was it done in school, out of school, or is there something that you actually just had to pick up with the job?
Yeah, I know for each person, because I'm listening to the panelists in all of our fields, you have to have certain situational awareness. I can't even imagine in dentistry what you all are dealing with and what might happen. But for my field, you definitely get better with experience. And the more situations that you're in, I'm a lot more confident than I was starting out, right? So that experience piece, but you can go to school for various aspects of this, but you're not going to get it until you're actually in it. For instance, my site went through a tornado, so most people can't say that. You actually might read about it, see it on TV, but when it actually happens, that's a whole different scenario. So that's made me a lot more confident having had that experience.
Well, if you allow me to add a little bit on this,
Yes, please.
traveling internationally, I can say that I can some of the guidelines and different protocols that have been established in the United States, I have been able to share them around the world or around the places that I have been doing all these outreach programs and these public health issues that we were is what you see sometimes, all the deficiencies that everywhere, and somehow that helps you to help them to know to have a better idea of what is possible, because we are very fortunate to live in this wonderful country who allows us to to do these kind of things and to find a specific department who can do all this research and establish different protocols to make the safety better, right? And so we can help others, because whenever you travel somewhere, wherever nothing exists, that helps them, to do that. And it's a very big eye-opening experience, because you realize how good you have it.
Yes, I love that you bring that global perspective in too, and that you use it as a way to give back. That's amazing. Thank you. Lauren, I'm curious, Dr. McCormick, do you have any thoughts? As I know in the research world, I know there's a lot of protocol in the practice side, but in the research side, you have a lot of consent forms, etc., privacy issues too. Do you have any thoughts on kind of that skill set, and did you build it in school, or do you build it along the way, or both?
Yeah, that's really important for research to have. We have our own safety protocols, like Frida was talking about, where when you're conducting research, one of the most important things we need to think about is human subjects protection. So we do research, we collect data all the time. It could be a survey, it could be medical records, it could be dental records, it could be focus groups. All that kind of data needs to be protected so that it's used in a way that is responsible and fairly, and people understand what's going to happen with the data that they share. So that's what you were mentioning about a consent forms and processes. Super important in health-related, medical-related research. So one of the things that some of us work on, one of the things I do is try to help make those consent forms like easier to read and understand, because that's the communication kind of aspect. Sometimes they're very complicated medical clinical terminology in them, and people may not understand what they're signing. So anytime you join like a clinical trial for drug discovery, for example, developing a new drug, you would be part of a clinical trial, you have to sign a consent form. So we'll work on those forms and use plain language. A lot of work is being done to communicate with people so they can make these informed decisions and use plain language. So human subjects protection, very important. Learning that, some of that you would learn on the job as a researcher. And there are different kinds of even online trainings that everyone is required to do.
Thank you so much. And Parisa, just one quick question for you. I think you might see some unique skills and challenges on that more business logistics side, working with children. Do you have any thoughts to add?
It's definitely, in dental school, we do take a semester business course, but I think that you can't really be too prepared for running your own business until you're really in it. You can always get other schooling, like a lot of professionals do get their MBA degree additionally, and that does help a lot. But for me personally, I think it's just been kind of figuring it out as I go, and managing the staff and managing patients, and then with COVID, trying to coordinate safety, just, little things like, as Frida was saying, we recently had someone drove into our building on accident. And so you have to, one little thing can change your whole, month. You have to really think on your feet and try to coordinate, and you always need to keep the staff safety in mind, the patient safety in mind. And so it is wearing many different hats, and it is very challenging, but I think it's always pushing you to grow and learn and continue your education. So it's very rewarding in that way once you're able to, handle a task.
Awesome. Stefania.
So she kind of leads into a question that was actually asked early in the chat of, how was medical school or school beyond college, and would you recommend that to other people? And you guys almost have started speaking on that, but I think answering Lainey White's question a little bit more could help her out as well.
Yeah, I think for me personally, I would definitely recommend it if it's something that you feel drawn to, and if it encompasses a lot of different fields. So for me, I worked as a sales associate in high school. I loved interacting with people. I loved making people feel good and by selling them clothing. And so that kind of went into dentistry because I wanted to make people feel good, but I also liked science and art. And so everything just kind of blended together. So for me, I found it to be perfect, but I think you have to just decide what interests you. And if that is something, science and helping people and interacting with people is something you're interested in, then go down that route. And if not, then there are plenty of other fields, because you want to stay motivated, because it can be very challenging to keep that kind of motivation through all of the tests and all of the, challenges all along the way. So that's just my perspective.
And sometimes there is no way to know until you are doing it. For example, dentistry in particular, or medical surgery and things like that. You think that you may be extremely talented for it, and I'm telling you, because we have to be very precise in prosthetics, right? So everything is to the millimeter. And a lot of my, I would say that specifically dentistry is one of the careers that you have to be very good in manual skills, and you have to be great in science. At the same time, you have to be a great business person, because if one of them is missing, you can be a very good business person and have a lot of knowledge in science, but if you don't have a good hands, then you cannot treat a patient in the way that he deserves, and vice versa. You can have a very good hands, but you are not very good in business, or you are not good in science, then you cannot do your job properly. So it's a little bit complicated, but you don't know until you are doing it, until you are basically in the field. And sometimes it's when you change a little bit your path, and then you select a different specialty or different area that you want to develop the same career that you already have devoted to. So sometimes in the specific dentistry, a lot of the students who are a little bit more challenging for them manually in dexterity, then they go to a different areas of, like radiology or pathology, or, to develop the scientist or the business part of it. Just an example.
Yes, thank you so much. And I think the second half of that question is, can any of you, and anyone who wants to jump in on this, talk a little bit about learning after you're done with school? So I had this kind of delusion as a child that I could finish school. What does it, how much do you have to learn? What do you learn? How do you learn kind of as a career professional?
I would say it's better to be a young person and already get it into your mind that you're going to be a lifelong learner. And if you do that, it'll make things a lot easier because you're really never going to stop learning. Like once you start on that quest for learning, it never ends. You're going to have a thirst for it anyways. So, and I'm just like Teresa, I'm like, oh, as soon as I would finish one program, I'm done. And then, and I thought I would take a hiatus or something. And it's like, oh, I got to go back to school. And then the moment I finish that, I'm going back again. And even now, you know, I'm not gonna, I don't plan, I can't say what I'm not gonna do, but I don't plan to get another degree. However, I'm taking all types of professional developments and trainings and certifications and things like that, because it just makes me stronger. I learn more, it makes me better at what I do. And similarly to what everyone else was saying, like do what you love, you're gonna have a yearning for it. And do that job shadowing piece that was just mentioned, like go out there and get as many experiences as you can. That's also learning. So it's not formal learning. You may not get a certificate or a degree from it, but you are learning about yourself.
Yeah, I'm going to add to that, completely agree. And the importance of experiential learning at all ages, including in high school, internships, cooperative educational positions are super helpful. And sometimes it'll find something that you say, wow, I really like this. Or you might say, oh, I actually don't really like that. And those are all important learnings where it can help you on your career path. Trying things out. Internships are a great way to be able to explore. And I would say that was probably a turning point for me in trying some things out, of saying, and giving some clues. So I definitely encourage folks to do that, because, and agree also with our careers are not necessarily linear paths. They can go in a lot of different directions, and that's completely fine.
Awesome. And I think we've officially naturally shifted into our career journeys section. And Stefania, I think you want to jump in with a question from the chat.
I do. So I see here that actually Lord Taylor, who is part of our Summer Ventures programming, actually knows about Dr. Shakuri's STEM journey. And she says, will she share her experience participating in the Summer Ventures in Science and Math program and how that affected her undergraduate pursuits? Because many of our participants today are either teachers or parents or students. And so given that perspective would be great.
Yeah, definitely. For me, going to Summer Ventures, I think it really changed a lot for my career goals. I was always pretty motivated in high school, but I just didn't, I didn't have a good idea of what I could accomplish, and I hadn't really been around many other high schoolers who were similar to myself, especially growing up in a small town that's not particularly diverse. And when I got accepted and was able to go to Durham and do the Summer Ventures program, it really changed my entire perspective. I felt like I could see, I made so many friends and connections, but also it got me really excited about pursuing a career in STEM. And I think that was something that I didn't know was really possible for myself, just because I had been in a little bit of a bubble. And all along the way, even throughout college, when one school I was looking at, I was going to room with a friend that I had made at Summer Ventures. So it gave me a really good community where we were all pushing each other and all wanted to, go become, get higher degrees. And I think that was really valuable.
Thank you. And Carissa, if you don't mind, would you just what does a day in the life of Summer Ventures look like? Or what did it look like for you? Because I'm not sure everybody knows what that is.
Yeah, so you are placed at a college campus, and I think it's a month long. I'm not exactly sure, but I felt like I was there for a month. I got to experience what it was like to be in college. So we lived in a dorm. We ate at the dining hall. We had classes that we went to, and they were all STEM courses. So I had a biology course. We did labs. I had a computer programming course. We had RAs who kind of chaperoned us, but there was a certain degree of independence. So you needed to kind of get a feel for what it would be like to be in college. And I think that was really valuable, just navigating, getting to one class, keeping your dorm clean and planning your going to the gym and going to the dining hall. And we had some social events. And it was also my first time being in a big city because I was from such a rural area. So I got exposure to just a lot of really neat things that I wouldn't have otherwise experienced. And I think it pushed me to want to, eventually to apply to colleges that were outside of my hometown and eventually move. I loved Durham so much that I ended up moving back there after I even graduated dental school. So it was a really kind of well-rounded experience for me.
Thank you so much for sharing. And that actually does bring us right to the next question, which I was going to ask. And so thank you, Parisa, for sharing. I'm going to throw it to Dr. Vera. Carolina, do you have a little bit of your career journey? So thinking childhood to adulthood and where you're at now, anywhere in between, a little story about some important turning points or maybe a class or an experience you had that kind of shifted your trajectory. I'd love to hear kind of your journey.
Yeah, actually I had a big influence in my family. My mother is a nurse. So basically, I grew up with that. I mean, looking at what she was doing, she was one of the head, she retired just a few years ago, but she was the head nurse of a very important orthopedic hospital in Mexico City. So we're talking about a 23 million something people city. So it was a person that I always saw her working, studying, taking care of kids, making the dinner, when she arrived at home. So I had a very strong role model at home that it could not understand a no for an answer, or like nothing is possible, So it's kind of how I saw it. So obviously it was pretty normal to me. Like, for example, right now, what I do with my kids, is something that I grew up seeing. And I think that was basically the first approach to the medical career. And I guess it's something pretty common, when you have a family member that you have a special love for that person, it makes you feel a little bit more interested about it, and you want to know, or you admire that person, so you want to be just like that, But on another hand, although, I grew up with, listening about stories about patients, hospitals, and things like that. Actually, I went to my mom's graduation, which I thought that was a very inspirational thing for me. I was always involved because of her in different programs since I was little, in different charity programs. I was always looking to be involved in with the Red Cross, or trying to do some volunteer work here and there, because I was always curious. I was born with a gene of curiosity on me, and I always like it. And I thought that it kind of give a very good perspective. So I would probably advise to anyone interested in the medical field, you really have to experience this. Although you are not really in there yet, you really need to know what is this, because you have to face different situations and circumstances that for some people could be a little quite shocking. So you really have to be involved and show the commitment. So if you are volunteering to one specific area, or you are shadowing, or you are doing some volunteering work, it has to, put yourself in mind that it has to be a long-term commitment where you can prove yourself, when you can observe others, where you can basically get a little bit of the taste of what does it look like to carry for others. Because in this medical field, one way to another, there is a lot of, it's not just professional, acknowledged, but it's a lot of self-sacrifice in the terms that, a lot of times has to be involved in studying, in learning more. And although we are not going to have another extra career or master's right now, I'm actually pursuing a different specialty in the area of sleep medicine, which I'm very passionate about. So it's, you never stop learning, that is you are treating one patient and you see something else and you want to keep learning. So that is what I will say, that I think, to me, all these little things that I was doing, you just make the puzzle to come together and be alive, to the person that I am now. Basically, the people that I know, the charities that I was involved, the volunteering work, and of course, I was always like to ask questions to the people who were in that field, and that kind of give you, you always, you kind of, there is an old saying in Mexico that the people who listen is the one who go a little bit above and beyond others. So I truly believe that. So I think if you are interested in that, you just have to experience it one way to another.
Thank you so much. I love the perspective. I love that you talk about volunteering as an opportunity to learn a bit more about the real careers too. Thank you for that. I have, this is my curiosity. Do you have any stories or any challenges or successes? I believe you're the only panelist that changed countries mid-career. So what was it like to go from dentistry in Mexico to dentistry in the States?
It
Any
was very
stories?
shocking. It was very shocking. Actually, I didn't think about to come to the United States. I mean, in general, when you are a little girl, I guess we're all female, so we know that we are dreamers, right? We always think about that, story in your mind that you don't know where you're ending. You don't know where you are going to ending up your life, but you're always dreaming to do something else. And since I told you, I always see a person that was a constant warrior, going against the flow. I guess I just have to, it was part of the influence. I always thought that I would like to be in a different place where I could, in my mind, I had the analogy that I could learn everything here, and then I can write a different chapter in a different place with a blank new page. And I didn't know how I was going to do it. I just knew that I want to fulfill the dream to experience a totally different world. And I'm talking to you about 20 years ago. I graduated in 2000 as a dentist in Mexico, and I think the society have evolved, and it has been a certain evolution in the professional acceptance more. More females are part of dentistry, more females are part of medicine, especially in the Latin American countries. But back then, I'm talking to you more than 23 years ago, it was a different point of view. And a lot of the times, I think, coming to a different country was a little bit more open to that perspective was also a little bit shocking. To change cultures was even more shocking, because Latino culture is very, is very tight. You live with your parents until you are married. Doesn't matter if you are 40, you still live with your parents. No, that's a joke, but it's true. It's a different perspective. I think it was not just the academic challenge. I think academics, I understood what was going to happen when I knew that I was going to change the country, but to live in a place that you don't know how to communicate well yet, because it's a different accent. I mean, you could learn English in your country, but then you're involving and learning science and all that stuff. New friends. I was fortunate that I'm in University of North Carolina, where it's a melting pot. and you have a lot of cultures around. And but again, I think culturally it was very difficult. And then you just have to, I remember, even I have to don't even talk much to my Latino friends because I have to learn the language and I have to perfection. It's not like my English is perfect right now, but you have to learn to communicate better with your patients. And so I decided not to speak Spanish much because I had to focus really to learn and be able to communicate right and do the things that I have to do in certain period of time. So anyway, as you can see, if that answers your question, but everything is just don't give up, because there is a lot of voices inside your head when you face the cultural shock and a new financial the pressure, and then the education and everything. It's a lot of voices who tell you need to give up. What are you doing here? Just go back to your country. You're safe with your family. But if you kind of have to be tough with yourself, and because when you come from another country, you kind of have to excel better there, so to be able to compete with the people here. So you really have to do a lot of things before you even think about crossing the border when you come here as a professional, to be thinking about that you are, you have to compete in a different university for 3 spots. When I came for my master's degree, they just accept 3 people per year. So obviously there were more than 200 applications. So I don't know, but so I'm just blessed and fortunate that I had this opportunity.
Great. Thank you so much for sharing that story. So interesting. All right. So with that, I think, Lauren, I don't think Dr. McCormick, we've heard anything about your journey yet. So any stories you want to share, something that stood out as a major success, a course and experience, a mentor, or a barrier that you found a way to surpass?
Yeah, so sharing a little bit about the journey. I think sometimes nowadays people feel like they want to go to college, they need to know what they want to study and what they want their career to be. And if you do know, that's fantastic. And if you don't, that's okay too. I was in the latter camp where I wasn't 100% sure what I wanted to do when I went to college. And so one thing I decided to do was go to a larger university, so that were a number of different choices and options. And kind of took a menu of different classes arranged, and I was fortunate to have a program where you could essentially create your own major, and some schools have this and some don't. So it's an interdisciplinary kind of program, and I knew I wanted to do something health related, so that's when I put together public health and law and business. And so not becoming a lawyer, but having some business classes. And so it was called bachelor's degree with an individual concentration. And it was at University of Massachusetts in Amherst. And so that was, I guess, super helpful for me. And as I mentioned earlier, I'm a big advocate of internships. So did a few of those. I remember going into the internship office where back in the day they had the books where you flip through the books, and nowadays it's all online, so that's much easier. But I did a couple internships, actually took a semester off in the middle of college to try out some internships and co-ops, and then that was helpful in terms of choosing that different path, going more policy and public health than clinical. And became an EMT, rode around in the back of ambulances one semester, got to see the clinical side, and just learned a lot, watched people, observed, stretched outside the comfort zone a little bit, which I definitely encourage folks to do. And learn from our mistakes. I think sometimes people try to be perfect, and we don't need to be perfect. We just do our best. And so I'm a big advocate of trying things out. So encourage that. And that's been part of my journey.
Thank you so much. And that is quite a unique degree pathway too. I appreciate that you shared that because I am 44 years old and I didn't know that was an option at some universities. I'm like, wait, that's going to be my next degree. Frida's probably laughing at me right now. I can't stop myself. Um, Dr. Teshigori, we started with you and we kind of snuck sideways into this section. So I just want to revisit with you. You told us a little bit about your journey. I just want to give you the opportunity with the formal question. Any particular, you spoke about summer ventures because we threw that one to you, but anything else you'd like to add? Any thoughts, successes or barriers?
I think just for me, some barriers were just kind of acclimating to college and disciplining myself. And I did have some challenges with some higher level, courses in college that I think I had taken some AP level courses in high school, but it didn't prepare me quite as much as I thought it would. So that was a challenge for me. But once I kind of got my bearings, then I started to get the hang of it and I formed a really good network. And I just tried to focus on research when I was in my undergraduate degree, and being at a smaller university, I think helped me do that. And then that helped me kind of build my resume and applications for when I applied later for dental school.
Awesome. Thank you so much. For me, learning about people's career journey is actually almost a small hobby. So I love to hear all of the stories, especially because when I was younger, I just thought you chose a career and that's what you did, which is, it's just great to hear all of your stories, and to think of you kind of as young women dreaming, and maybe not dreaming exactly what you, oops, sorry, I think I just shared the wrong tab. Sorry.
Did we hear
Trying
from
to get my
Frida?
slides back. Yeah.
Did we hear from Frida yet? I don't know if we heard from Frida.
Oh, did we not? Thank you, Stefania. Dr.
All right.
Sanders, I was just calling you out and I didn't even give you the chance to have the mic.
No, that's fine. So for me, that's a interesting question about career journey. So I'm from Chicago, Illinois, and Chicago proper. I grew up on the south side of Chicago, where a lot of people didn't end up like me in similar professions. And I went to public school, didn't have the best teachers or really programs or anything of that sort. But where things changed for me is where I went to a magnet high school. And it was actually on the last farm in Chicago. So Chicago High School for Agricultural Sciences. And it's the coolest thing. You have to look it up, but it's called CHAS for short, CHSAS. And there, my whole world changed. I was exposed to all kinds of things. We had an animal science wing, we had goats and chickens and marine biology, and you got to choose your major. So I'm an advocate for early college programs, even if it's not a program where you go to a degree, where you actually get a degree or any collegiate credits, but where it exposes you to various fields. So we got to choose a major, and mine was ornamental horticulture. I didn't really know anything about it, but I liked plants. And so because of that, and just to back up a little bit, you had options of like food science and animal science. So I liked them all, but I was like, oh, I like plants the most. And through that, I knew I wanted to go into botany. So then I went to Tuskegee University, where George Washington Carver did his research, who's still my role model to this day. And I actually got to do my undergraduate experiences in the same lab that he did his. And so that was really sobering. And I felt like those late nights that his spirit was there with me, kind of rooting me on. And I did research with peanut, sweet potato, soybean, and worked on various projects. And I just knew that I loved science and I wanted to be in the science field. And I would just encourage you to just keep going with what you love and what's drawing you. if you think about it right now, I'm not a scientist in a laboratory, but because of every one of the experiences that I've had, I can actually approach safety differently because I know what it's like to do research. I know what it's like to pipette samples all day or extract DNA or RNA. I've done that numerous times. And then I know the challenges, the ergonomic challenges and things along those lines to where I can approach it differently in my career. So it'll all make sense one day. So just expose yourself to as much as possible.
I love that. What a great sentiment. It will all make sense one day. And then we'll start over again, right, Frida? We're like, what else can I learn?
That's
And
right.
continue to build. That's fantastic. All right. Well, right now, what we're going to do, I'm going to share my screen, hopefully the right tab this time. And our panelists just have a couple of curiosities about you. So what we're going to do is invite you to jump into this Jamboard. And Stefania's going to drop it into the chat. And what we have in the Jamboard is a couple different pages for you to put some responses in. So if you click on the link that she dropped in there, I will hop out of the slides and into the Jamboard so you know you got to the right place. If you're seeing this is the Jamboard. And up here at the top are little arrows, and that will bring you from board to board. And so you'll see there's a couple of questions specific to students. And then as you go through, there are questions for students and teachers. We want everyone, parents, to jump in on that one. And then the third one is specific to teachers. And so as you jump in, if you've not used a Jamboard before, what you're going to do is read the question at the top. And when you feel like you have something that you want to respond, if it resonates, you're going to click on this little sticky note icon. And if you want to change the color, you can. You just pick the color that you want it to be. And then what you can do is type right in here. Type in here all your amazing thoughts and hit save. When you hit save, it's going to pop a sticky note onto the Jamboard. You can move it around. Sometimes they land on top of each other. It's okay. And the reason we're using the Jamboard format is so that you can jump into whichever board you feel like you have a good response to. And this allows us to capture many thoughts and to take time to read through all of them kind of following the webinar. And so everybody should have added access. And if you have any trouble, you can pop in the chat and we can help you out. Stefania and I are both going to be able to watch that. And you can jump in and start to kind of add your thoughts. And don't worry, if you go past the last board, it'll just show a blank board. Don't worry about that. Just arrow back. Ooh, and I love that teachers are jumping right in. I agree. As many opportunities for us as you can that's free or low cost. I love when people let us come in to see their role, job shadows, internships. We love it all. And if ever possible, a paid internship for a young person would be amazing. I know those are harder. If you make a mistake, you click on that, you can either edit or delete once you click on those three little buttons in the corner. All right, I'm going to let you all continue to populate that.
And don't feel limited. Please feel free to answer on any of the boards. So we'll take the time to do that because our panelists are eager to hear what you are thinking. And since we're in the virtual environment, it's kind of like our way of having a little powwow or a little jam session ourselves. So the more you can put in there, the better for us.
That's awesome. And I will. God, I'm seeing a couple of relates to being kind of the minority in the group that they're working within. Yes, and I think that's in a lot of stories from from the women perspective and many other subgroup perspectives as we think about kind of climbing those, going through academia and informal education experiences.
That's a great point with us having an all-female panel. I had talked to Dr. Vera, and we had jokingly talked about some of the challenges of being a female in your various roles. But if you'd like to share, that would be awesome too, just to kind of hear, yes, you've risen to this level in your career, but does it still present any challenges for you? Or are there things that you'd like for the students to know, teachers as well, that just gives them a little bit of a heads up of what they'll face, whether it be in the career or in aspiration of the career, whatever you'd like to share.
Written or speaking?
Speaking is fine. Yeah, yes, yes.
Yeah, so, well, it's exactly what I was talking and sharing with you, specifically what is the, the challenging to be a mom and to have two little ones, with you, and it's difficult because, countless time I hear between females, when we have these meetings about, how important it is to find the right balance, with family and work and, and doing what you have to do and your personal time, and be selfish with yourself, to give yourself a little bit of time. And I think, I don't know, maybe I'm different, or I cannot find the right combination, because it doesn't exist such a thing for me, at least in my life. It's always the perfect balance doesn't exist, Usually people who you love the most, which in case sometimes it's family, are the ones that get a little bit of sacrifice, a little bit of squeeze in different things, Of course, I like to be doing charity programs, this where my heart is, and have done it for more than 13 years. So obviously, what do I do if I have to travel to an orphanage in Mexico, for example? So I have, sometimes I travel with my little kids. The first time when my kids were little, they were probably around 2 years old, 2 and 3 years old. And I have to leave them with my mother. My mother lives in Mexico City. So when I was going to the orphanage, my kids were with grandma. However, and it's great, they shared time with her, but obviously I didn't see them for several days, or right now they have become my forced volunteers. So all these programs that I'm telling you about, the Science Day, and we have a food stand on Wednesday nights. They have a program in a specific a church that they go, and then they have a food stand where they sell food. So all the money that gets donated earned by them, it is basically donated to have somebody else's to cover somebody else's need. Some of this money had become to do the programs in Mexico, and actually the last one was last week. We are sending 2 kids to Disney, to help in a specific camp that they're going to do. They're kids with very, very small resources. So in Build Your Smile, we believe that we can build smiles, not just with beautiful teeth. It's just building a smile with soul. And I share those things with my kids. But again, family, sometimes you are the last one who goes to do manicure, or I don't know, sounds silly, but everybody goes, or you buy the food for everyone and you don't buy something for yourself. That's as a female is what I face constantly. Maybe one of the other panelists can tell me what is the magic recipe, because probably for you guys it's easier. I'm still trying to figure it out how to make it happen for me. And I love what I do. I'm extremely passionate about all my constant programs and the interaction that I have, for example, in meetings like this where I can participate and share my career or what I love to do constantly. But that doesn't make it easier. So if somebody wants to kind of share these stories about how can I find the right formula, I will love to have some advice from all of you guys.
Yes, I would love it too. Any of you have the balance figured out?
Nope. I'm just like you all.
Mhm.
Just take it one day at a time, that's for sure. But like Dr. Vera said, incorporating your family in what you do, that definitely helps, right? Because then you get to see them and create those experiences like you had with your mom and seeing everything that she did that was inspiring. So you don't know how you're inspiring your own children by allowing them to watch and be a part of what you do. But no, I don't have the magic formula.
Yeah,
I love that you. Oh, go
I,
ahead, go ahead.
I've seen it, in this case, with the little ones, and how right now, my little kids are doing business. I mean, they're at school, but they are doing business. They are in Chinese school, so obviously they speak Chinese, and and right now they're thinking about whether they're gonna sell next, to be able to help others. So I think it's pretty cool.
I love that. I similarly had that, but I call it mom guilt, especially when I went back to school. And I know your careers require sometimes more formal education, sometimes just like reading a lot of journals, keeping up to date, or any kind of ongoing learning. Does anyone have any thoughts about kind of that balance? Like I worked during college. I'm sure many of you worked during college, or now that you're a career professional, you balance that with ongoing learning. Any thoughts on that?
I think, oh, sorry.
No,
No,
you
you
go
go
ahead.
ahead. You go ahead.
Oh, okay, you're gonna make me go. So, so, so I was gonna say, for me, really, I don't know that it's good advice because I feel like I sacrificed myself a lot because I didn't want my family to eat dinner without me and, have these different experiences without me. So I would wait until late in the evening to do some of my work or just try to cram it in. Like I've always worked full time, usually had a part time and gone to school because I also teach biology at Wake Tech Community College. And so um, it's been difficult to juggle it all. I have gotten better over time, but sometimes when you're multitasking, you're thinking that you're a master of it, but something is missing. So sometimes you just have to let something go. And I'm learning to do that more so. So yeah, I would just say let something go, say no to some things because there's a season for everything. And if that's your season, you're going to school and you're working full time, you can't do everything.
And Dr. Teshikori?
I was gonna say that for me personally, just with trying to, I've had a few different positions as an associate dentist, and just kind of having the confidence to ask for what you want, especially, know your worth. And I think I've struggled with that a lot. And I don't know, that's probably complex for whatever reason. I don't know if I, if things would be different if I, you know, just was from a different circumstance. But I think that that's a big challenge, is just speaking up for yourself in a professional environment and knowing your value, even if someone else doesn't necessarily see you as, someone else in their field as the majority, for example. But also not, having boundaries as far as work boundaries and not overcommitting, because you can get burnt out pretty easily. And sometimes it's better to just have limitations about the things that you commit to. That doesn't necessarily mean that you're not as good or not as valuable, but that just will help you kind of be better at, your job.
I'll just chime in there. One of the nice, I guess, maybe silver linings with from COVID, if there is any, is the hybrid workforce that many employers have moved toward, of allowing some people to work from home if your profession allows that, either part of the time or all of the time. And so more people are adopting that. So that's one source of flexibility that you can also ask for if it's not offered to you. And it may not work in all cases, but other kinds of flexibilities are working less than full time. So we have a number of people who have very successful careers who are working, whether it's 4 days a week or 3 days a week, and just like to see that creativity in the workforce as we go into the future. So if that's one of the things that could help you and balance that with your family, that's one of the things I encourage people to ask for.
Okay, thank you so much. All right, with that, we're going to shift into our last little segment. We have one more question. During this time, we also invite participants to drop questions in the chat. I do want to acknowledge the request for the information on the Science Day at the consulate. Yes, we will definitely, Dr. Vera, thank you for being willing to share that with us. We will include that in the follow-up email for everybody. And so if you want to, if we can just keep you on here for an extra minute at the end, we can get those details from you.
Absolutely.
Great, thank you so much. All right, our last question, and this is from the team at the collaborative. One of the things we acknowledge about K-12 education is it often kind of separates the disciplines very strictly with silos. And so this is mathematics, this is science, this is history, this is English, this is, but we know from our experience that career world, especially in STEM, can be very interdisciplinary. And so we'd like to kind of invite you to share a little bit about who do you collaborate with? What does that look like? So it can be role-like collaboration, or it could be learning from people that are from a field that is maybe not specific to your core concentration. And what is interdisciplinary about your work? What goes beyond the scope of what you went to school for? And I'll invite, does anybody have a thought to get us started?
Well, I think that the multidisciplinary approach that, as a dentist we have, I mean, I'm talking about me in my experience, it's always, it's specifically, for example, I'm telling you about the sleep medicine. The reason why I become completely, in love about this other career switch, it's not career switch, but it's a totally different area in prosthetics. A lot of prosthodontists, I mean, I do implants and I do all the other stuff, but during because my family, I kind of observe that my kids were developing something, related to a sleep disorder. And, I feel like it was a lot of misinformation, and I could not have the help that I needed. And then, kind of inspire me to be a little bit more, I challenged myself to learn, to kind of learn different things, go into articles, go and look for more books and do it, and, I think we are very fortunate that the pandemic also opened the horizon to do a lot of things online and learn. So, I see that the sleep medical field had been a little bit older in Europe than it is in the United States. So, I started researching, and it's right now, that's why I decided to study that course in the Catholic University of Murcia. And it's fascinating. But I'm saying, in the sleep medical field, I kind of go sideways, sorry. But in the medical field, you always have to talk about it. I mean, right now I have to talk to the ENT. I have to think about how we can collaborate to make this, thing better. And right now, for example, doing research. I can tell you how many little toys and different things, not toys, I mean, different specific equipment or different things that they come into the market to see how we can help that patient who has sleep apnea, for example, and then you do research with it. Like, okay, if this machine works better than this one, and then, that's why you need a person, involved in research. Or if it's safe, is this medication safe? Is this a specific equipment used for a certain period of time is going to help my patients to overcome the problem that can kill them, like apnea, or not. So it's what I like about my work and how rich and fulfilling is to talk about a lot of brilliant minds around me. So I always learning. I always feel like I'm constantly learning for other professionals. Is just solving one little thing, because specifically in this field there is not a right answer. It's not the right formula to make a patient completely succeed about how to handle the sleep medicine. It's a combination of different things, and you get the acknowledged through the collaboration with other professionals.
Great, thank you so much. Dr. Tashikori, any thoughts on this? Interdisciplinary
Yeah,
and
I think-
collaboration.
Absolutely. I think, in the medical field, there's a lot of room for interdisciplinary collaboration, but also in my community, I participate on a board for a local free healthcare clinic. And so we have public health students, we have administrative students, we have all kinds of different, we have nursing students. And so we kind of all try to collaborate together on this one big idea, as well as like fundraising, marketing. There's all these different things that you can get involved in. Just with my specific field, working in a hospital, similarly to Dr. Vera, ENTs and children and sleep apnea, that they all work together. Plastic surgeons, it's just expansive, as wide as you want to go. But I think, and also dentistry relies a lot on materials. And so the different scientists who research and come up with the components of different materials that we use in the fillings, in the crowns, in the different types of metals, all of that is just collaborative and interprofessional. So there's many different hands in the pot.
Great, thank you so much. Dr. McCormick, what does interdisciplinary work look like in the research world at RTI?
So research is frequently interdisciplinary, and I think that is one of the things that makes it exciting. I mean, sometimes we will have projects that are large and can last years. And so you're working with a team of, sometimes it's 10 people, sometimes it's 100, and they could be at universities across the country, in domestic international research collaborations. So some of the COVID research, for example, includes hundreds of different universities looking at some of the work related to long COVID. And so our teams can include economists, statisticians, survey methodologists, clinicians, all different types of clinicians, nurses, social workers, therapists. So a lot of our work in opioids, for example, when we're doing some research on interventions to look at and support people in pain, we're working with cognitive behavioral therapists and designers, editors. And so just understanding and respecting the disciplines and the talent that different people bring, and being able to enjoy that. That's one of the nice things about research.
Great, thank you so much. And Dr. Sanders, what does that look like at Pfizer in your world?
Well, not even just at Pfizer, but just in safety in general. Very interdisciplinary field. Like I said, there's no one that I don't interact with. So, and and it's really equally dispersed amongst everyone. So definitely have to interact with local emergency managers, all the first responders. You want to bring them to site, right? Your fire and life safety professionals, paramedics, and police officers. And then definitely with the EPA. So in North Carolina, that's the North Carolina Department of Environmental Quality, making sure that our stormwater, storm ponds, wastewater, all of that is up to par. We have any air emissions, the NCOSH, which is OSHA for North Carolina. So definitely having to keep up with those compliance standards, the research scientists for like biomedicine design, so that drug discovery that Dr. McCormick was talking about, and all the way up to manufacturing operations, microbiologists, chemists, biosafety professionals, industrial hygienists, construction workers, electricians, facilities and maintenance, engineers, of course, and then quality control. Those are the people that will really shut you down. So yeah, a lot of interdisciplinary work.
Great, thank you so much. I love that, and I look forward to the day our K-12 world looks a little more like that. We do have just a couple minutes left, and I want to offer the opportunity. I guess we'll kind of go in reverse order and start. We'll have you continue, Dr. Sanders. Do you have like 30 seconds of advice you would give young folks or educators kind of about your career or career pathway journeys? Frida, you are muted. Sorry.
Sorry. So I would definitely say, stay open-minded. Don't be closed-minded. Don't put yourself into a box, and don't really allow other people's perspectives to put you in a box. It's your life. Of course, you take wisdom and guidance from anyone, and you can learn from any situation. So it's all about your perspective. And, we have barriers. Just expect that there are going to be barriers, and then challenge yourself to get over those barriers and to grow stronger because of it. So just keep learning and exploring.
Great, thank you so much. Dr. McCormick?
Yes. So I would add to that a great start of continuing to develop skills over a lifetime during your summers, making really good use of your time, trying new things, and spend time with people who are a positive influence and make you feel good and fill your cup up.
Great, thank you so much. Dr. Tashikori?
I would agree with all of those points and echo all of them, but additionally, just to kind of stay true to your own goals and values, and then that way, you'll always be motivated, and just stay, persistent on what you want, even if other people have different ideas for you, or like Frida said, put you in a box. That doesn't necessarily define you. So there's no limit other than what you give yourself.
Thank you so much. And Dr. Vera, any last thoughts?
Well, I would think that also learn to be resilient, because the success doesn't come quickly. In general, you have to work for every single thing that you want to accomplish. I think, I'm a professor, so I deal with, younger generations, and sometimes they, it's kind of hard to think that everything has a time and it's a process, and it's easy to get frustrated or desperate because you want it now and you want to make it happen quickly and fast and beautiful. Not everything happened like that. So just if you want to do something, you have to think about it specifically, intelligently. What do you want to do? What do you want to accomplish? How are you going to get there? And then don't get discouraged. Just basically be focused specifically in what do you want to do and how you want to make it happen. So don't get discouraged. Just keep going to make it happen for you.
Great. Thank you all so much. with that, it is time for us to wrap up. We're just right at 8 o'clock. And first, we want to thank all of these wonderful, amazing STEM leaders and women who joined us tonight. Thank you all so much for taking the time out and sharing your stories. Very, very inspired as we got to hear and learn a bit about your journey. We do want to invite those who could join us live and those who are going to watch the recording to join us and for our next couple of upcoming webinars in our STEM series. So coming up on April 18th, the focus of that career pathway will be computer science, AI, gaming, and data science. Following that in May, we'll kick off with biology and neuroscience on the 9th and follow that with engineering. We just want to take this opportunity to say thank you to you all. If you want to learn more about doing research in North Carolina, you can reach out to any of us and we will be happy to follow up with you and get you connected to the right people. And with that, we want to thank the Burroughs Welcome Fund and the SMT Center for making these webinars possible and for supporting the work of the collaborative and children all and teachers all across North Carolina. Thank you all for joining us.
Thank you very much. Good night, everyone.
Good
Thank you.
night.
Thank you, ladies.
Thank you.
Thank you.